Medicaid, Medicare. They sound a lot alike, but they're actually two very different programs, and knowing the difference really matters, especially in Utah. Here's a simple trick to keep them straight. Think CARE for Medicare and AID for Medicaid. Medicare is a federally funded program that cares for seniors and people with certain disabilities by providing health insurance. It's run by the federal government. Medicaid, on the other hand, is a joint state and federal program. It provides aid for low-income children and adults, pregnant women, and people with special medical needs. Here's something that might surprise you. In 2024, Medicaid covered 1 in every 13 Utah adults ages 19 to 64. As of 2025, about 70% of those adults are working at least part-time, and over a third are working full-time. That's higher than the national average. Now let's zoom out a bit. Across the country, Medicaid enrollment varies quite a bit, but Utah still stands out. Only about 11% of our population is enrolled. That's the lowest rate in the country. In Utah, about 2/3 of the funding for this aid comes from the federal government, the rest from the state, and the program is administered at the state level. Here's how it breaks down in dollars. Utah spent nearly $3 billion on Medicaid in fiscal year 2018. Medicaid expansion went into effect in January 2020, providing aid to adults earning up to 138% of the federal poverty level. Since then, Medicaid costs have gone up. More than $5 billion was spent on Medicaid and the Children's Health Insurance Program, or CHIP, in fiscal year 2024. Of that amount, the federal government covered nearly 70%, or just over $3.5 billion, while the remaining funds came from various state and local governments and health organizations. In fiscal year 2026, the federal government contribution to Utah is nearly 10% less at just over 62%. Nearly 340,000 Utahns rely on Medicaid today. This number includes kids under 19, pregnant women, people with disabilities, seniors, including nursing home residents, and some adults, both with and without kids, who meet income requirements. In fact, children make up 71% of all people on traditional Medicaid. That's 1 in every 6 kids in Utah. Only about 1/3 of Medicaid funds go to hospitals. The rest pays for things like professional services, pharmacy, and administration. Medicaid supports patients, providers, and hospitals across Utah. Knowing how it's structured and who it serves is central to shaping responsible and informed health policy.